Well, new warnings tonight from physicians that under Obamacare, despite the president's promises, you may not be able to keep your doctor or your hospital, and we're learning exactly why that is. Dr. Eric Novak testified before the House Oversight Committee on these concerns yesterday. He's also an orthopedic surgeon and partner at Ortho Arizona in Phoenix. Doctor, good to see you. So,
thank you, Megan.
In a nutshell, explain exactly how it's going to work, because, the president has maintained all along you will be able to keep your doctor.
The short answer is there's no evidence that anybody is going to be able to keep their doctor to any significant degree. Nobody knows the rules. We don't know the rules as providers. Patients don't know the rules. And come January 1st, it's going to be very hard, even with the promises and the things that HHS is doing, to force insurers for us to know who really has coverage and who doesn't.
You talk about how access is going to become the problem, access to your doctor. What exactly do you mean by that?
Well, it isn't enough simply to give somebody a card. What we want to try to do with the law, or with any healthcare reform, is to actually lower costs and increase access. And the problem that we're seeing already, as everybody knows, is that, simply put, people don't even know if they're covered. Well, on the provider side, we don't know if the card people are coming in with actually is valid. And so ultimately, what that's going to do is reduce access. The second thing is, it's looking more and more like, with these restricted networks and lower payment structures, that very few physicians are actually going to be staying on the networks or even seeing these patients.